So mental capacity is the ability to make decisions. It's based on a legal framework in the UK called the Mental Capacity Act. There are certain times when somebody has, and this is using legal language, an impairment of brain or function that reduces their ability to make a decision on something very specific. So sometimes we're asked to, as clinicians, to make a judgment on whether somebody can make a decision about a very specific situation.
So for an example, it could be around someone's finances, so the decisions around their finances to make sure that they're safe and protected. But it also could be for someone's kind of healthcare. It could be around their litigation, so it's whether they're able to kind of instruct solicitors. It could be around testimonial capacity. It's dependent on what might be challenging for that person in that moment.
It works on 4 different principles. One element would be whether an individual can understand the information that's been given to them, whether they can retain that information, whether they can weigh the pros and cons, and whether they can communicate whatever decision that they are thinking of. So if you look at someone with perhaps a diagnosis of dementia, they may be able to understand the information that's presented to them, but they might not be able to retain it.
I think sometimes people might feel that there's a punitive aspect to having a mental capacity assessment. They fear kind of what might happen as a result of the findings. I think what I would like to reassure people is it's a supportive approach. It's looking to empower somebody. And if there are findings where someone might lack capacity, it's only for a specific area that we look at. So every step of the way, we will look to reassure and explain what we're doing, why we are doing it, so the patient feels involved and part of the process.